I will tell you when it's on. All right, we are now live. So, hi everyone, and welcome to today's broadcast of Meet the Experts at St. Joseph Hospital. Today, we are joined by two of our experts from the new Senior Behavioral Health Unit at St. Joe's. So today, we are joined by Maria Jackson, who is our newer program director for the unit, and as well as Dr. Jody Marshall, who is our medical director of the unit, who you may have met about 6-7 weeks ago when we did one of these broadcasts initially. So I'm going to let Dr. Marshall and Maria kind of tell you a little more about themselves, and then we're going to get into some questions that we kind of commonly get from patients and family members about the behavioral health unit and what you could expect when being on the unit. So we'll start with Maria Jackson. Tell us a little about yourself.
Sure, thank you. So I am new to St. Joe's. I've been here since February 8th, so still pretty new, but I come from almost 20 years of experience working in inpatient acute psychiatric care. I just came from running a 71-bed acute freestanding psychiatric hospital in Massachusetts, where we had both adult and geropsych units. By trade, I'm a social worker, so kind of came up from working at that facility as a social worker on the unit. It's always been my passion and my love to do inpatient psych, and so I'm so happy to be here at St. Joe's to help, get this program going and expanding and meeting the needs of the community.
Hi, everyone. Thanks for having me. So I'm Dr. Jody Marshall. I'm the medical director of the Senior Behavioral Health Unit here at St. Joe's. I've been here since December. I'm excited to be here to continue to grow this program. And again, just as Maria said, to meet the needs of the community and the state. I am a board certified geriatric psychiatrist. What that means is I do have specialty training in the needs of patients over 65 with mental health conditions. I also have board certification in general adult psychiatry as well. I came from being the medical director of another geriatric psychiatry facility in the area, so have experience as to what the demographics are and what the needs are in our state and our community, which is continuing to grow as far as geriatric care goes.
Tim, I think you're muted.
Sorry, I muted myself there. So once again, this is part of our Meet the Expert series, where each week we are interviewing different providers from different departments and units throughout the hospital. And throughout today's broadcast, which is only about 15-20 minutes, you can ask questions in the comments section, whether you're watching on Facebook or YouTube. This is actually streaming live into multiple locations. So if you ask a question or have a comment, we'll see it and we can actually put it on the screen so that either Maria or Dr. Marshall can answer it in real time. So feel free to ask your questions as we go in the comments section, and we'll do our best to get to it. So we're going to get started. And again, we have some kind of a list of pre-made questions already that we commonly hear from folks in the community, especially being a newer unit, and they want to know kind of what it's all about. So one of the first questions we are often hearing is, what is senior behavioral health? So Maria or Dr. Marshall, who would like to take that one?
Sure, so I'll start. So senior behavioral health is obviously meeting the needs of people. For our unit, it's considered 65 and older because it's especially a population who has individual needs and requirements. And for our unit, it's trying to meet their psychiatric needs.
Okay, great, thank you. So kind of building on that, the next question we often get is, so what is the senior behavioral health unit? What can people expect? What does it look like? What can you tell us about it?
Sure. So the Senior Behavioral Health Unit, we are currently a 24-bed inpatient psychiatric, and it's all new, so it's very beautiful, and it's specialized in treating people who are 65 and older with psychiatric disorders. I'll have Dr. Marshall talk a little bit more about that, but we do safety stabilization, crisis planning, medication management, discharge planning to help transition people back to the community to get them back into their lives or get them to the next level of care to best meet their needs. We've got a great team made up of obviously Dr. Marshall. We have social work, rec therapists. It's a really great unit. It's right now, we have people in their own rooms. Eventually it will be double rooms, but a very nice, we don't like to say quiet and psych, but calm unit to help people to recover.
Great, thank you. Dr. Marshall, so another question we get is, St. Joe's used to have a senior behavioral health unit that was closed down a number of years ago. So why did we bring it back now? What was kind of the impetus for bringing it back?
Well, I think one of the greatest reasons why it was brought back is to meet the needs of the community. The state of New Hampshire has one of the largest aging populations in the country. So we are seeing a huge need for all kinds of geriatric care, whether it's internal medicine care or geriatric psychiatry care. The number of patients in our state that need specialized care in this way is increasing. The number of patients in the community as well with dementia is increasing. We have more patients and less resources than we need right now. So building this unit was one way to meet the needs of the community and for our aging population that's going to continue to grow.
Great, thank you. And Dr. Marshall, we'll stick with you for this next question. What types of services or treatments do we provide on the SBHU?
Yeah. So it is a treatment team approach. We have individualized treatment plans for each patient. Their treatment includes psychiatric medication management on a daily basis by the psychiatrist. They also get group therapy programming to the degree that they can participate in that. We have a dedicated recreational therapist on our unit, which is a wonderful addition to this type of unit. Patients also receive social work. Social worker works in collaboration between the patient and the family and making sure that communication remains active, and also in looking at what are the best discharge plans for that individual. So we have that aspect as well. We also have the general medical treatment that they'll receive on this unit. Our geriatric population also has, as you can imagine, many medical comorbidities that need to continue to be addressed during their stay. So they're seen by the hospitalist team, which is the inpatient medical team, during their stay to manage any medical issues that are ongoing. We also have the availability to institute physical therapy, occupational therapy, speech therapy for our patients. So it is a well-rounded treatment that they get while they're here, psychiatric, medical, rehab, etc.
Great, thank you.
Mm-hmm.
All right, let's go back to Maria. Maria, what does a typical day look like on the SBHU? If you're a patient, what can you expect on kind of a day-to-day, hour-to-hour basis?
Sure. So everyone's treatment plan is individualized, but in general, in the morning we have LNAs on the unit, and they help everyone get up and get ready for the day. Get ready for breakfast, eat. They'll meet with their social worker, Dr. Marshall, or the provider, talk about their treatment plan and where they are within their treatment, and they'll attend groups. So there's several groups throughout the day, and those groups vary depending on the group that we have on the unit and what's best for them. So whether it's more activities based or more cognitive behavioral or more discussing things like grief and loss based on the individual. So those groups are throughout the day, and of course they'll meet with their nurse. They're assigned a nurse every day, and that nurse is checking in with them, providing medication, providing education around medications, monitoring any medical issues that may arise, and being their contact person for any conversations. And of course, the LNAs are moving throughout the unit all day as well. Everybody's on 15-minute checks, so there's always staff that are checking to make sure that everyone's doing okay, if they need anything, and making sure everybody is safe. And that goes on right straight through the night, straight into the evening with groups, lunch, dinner, and then depending on the individual and what time, but usually around 8, 9 o'clock, everyone's sort of getting ready for bed, and we have our LNAs and nurses who will assist the individual to get ready and do their bedtime routine. Part of what we hope is to have people have more of a routine. Oftentimes they fall out of a daily routine, which throws off their cycle. So the staff's here to assist them with that while they're getting treatment.
All right, thank you. So actually, with that in mind, how long are patients typically staying on the unit? What's kind of that average length of stay?
We get that question a lot, and especially, in terms of educating families for what to expect. What we typically tell families is expect the average length of stay to be somewhere between, I would say, 11 and 14 days. Everyone's length of stay is very individualized to meet their needs. But I would say, on average, when we are talking to families and helping guide them through this process, which can often be stressful for them to have a loved one on a psychiatric unit, I say roughly 11 to 14 days.
And this isn't really part of our list of questions, but one just kind of came to mind. If a person on the unit has a medical issue, can they access the other resources of the hospital while they're there?
Absolutely. So as I mentioned, they are seen by the hospitalist team. So the hospitalist is our inpatient medical team. So they get a full medical assessment when they get here within 24 hours of coming to our unit. And then any urgent medical needs that come up on the unit are addressed in the appropriate time frame by the hospitalist team. So absolutely.
And again, kind of going along that same line, how have we handled things around COVID with admissions? Are we testing patients before they arrive? Are patients being vaccinated? What's that process look like right now?
Great question. So as you can imagine, because we are a geriatric population, we have to be more safe than most. So for that reason, one of the things that we do is there are no visitors on our unit. There are visitors that I understand that are being solely allowed to come in on other floors and other departments. However, we still have a strict no visitor policy to avoid anything being brought into our unit. Patients have to be tested for COVID prior to admission. So before they come to the unit, we need to have them COVID tested. In addition, when they get to the unit, they are COVID tested again. And then we have generalized testing every 7 days on all of our patients while they're here. So we are doing the best that we can to maintain COVID free. Unfortunately, we don't have the ability to vaccinate patients on our unit. That's a very regulated process and guided by the state. So it's not something that we have the availability to administer to patients on our unit. In addition, we do have the staff being able to get their vaccines, which has been excellent. We have a high percentage of staff that have received both vaccines by now. So that's another way that we are maintaining a safe environment for our patients. In addition to wearing masks, et cetera, the basic safety protocols that are now in place everywhere.
Great, thank you. Mm-hmm. All right, going back to the questions that we had set up. Another question is, and you kind of referenced this both of you initially, but what is the makeup of the medical team? I know we talked about social work, doctors. What else should someone expect?
Mm-hmm. So the primary team is made up of the physician, the social worker, the recreational therapist, nurse, and an LNA. In terms of the patient's team from day to day. That's who are their primary contacts. We all try to meet, the patient's individual needs based on our specialty. So that's the general team, if you want to look at it that way.
And then how is communication handled between patient and family? Is family contacted daily? Are they emailed updates? How do they find out what's going on with a loved one during their stay?
So our main contact is via phone right now because we don't have visitation. We previously would do often in-person family meetings throughout their stay. However, that can't happen anymore. So we utilize conference lines a fair amount of the time, which actually it works very well when patients' family members can be all over the country and all participate in their treatment planning. So it is phone calls. We do our best to contact family members on a daily basis. However, obviously sometimes that doesn't always always work out exactly as planned, but I tell family members at least every other day you will get a call from the physician with an update. And then as you can expect, the social worker is also calling throughout their stay. And the family members are also encouraged to call 24/7 to the nurses station to get an update. As I mentioned before, this can be very stressful for family members to have their loved one here. So, I can say call before you go to bed, check with the nurses, how the patient's day was, just get some reassurance. So the nurses are always available to give an update to the family. And families can also call directly to the patient. We do have that availability that the patients can talk to their families at any point as well.
Great, thank you. All right, Maria, back to you. Who is eligible for the SBHU? What, how would a patient even get onto the SBHU unit?
Sure. So we receive phone calls from family members, primary care doctors' offices, emergency rooms. So anyone who feels that they have a loved one or a patient that they, a client that they feel needs our services can call our, call St. Joe's and ask for the SBHU, or they can call the unit directly. And again, it would be anyone who meets our criteria. We say 65 and older. Sometimes if they're younger and meet our criteria, we might look at that too. But generally 65 and older has a psychiatric illness or is in acute distress. We oftentimes, would recommend if, it's more urgent or it's crisis that they do go to the ED to be screened there, and then we would take it from there. And then we do first a clinical review, make sure that they're clinically appropriate for the unit. We are a voluntary unit, which I don't think we talked about. We're a voluntary unit, so the individual needs to be capable of saying, yes, I want psychiatric treatment, or they need an active DPOA that states that that person's able to make those decisions for them. So we need to check into that and make sure that, obviously we have the bed and are able to treat them, but anyone can call and we would give them guidance. And if it's something where, we decide through the phone call that we're not able to provide services, we would also give recommendations for other services, alternative services, other, resources that they could reach out to.
Great, thank you. So I think you kind of referenced this, but one of the questions is, who can refer a loved one to the SBHU and how do they do it? Can you self-refer?
Yes, I mean, someone could technically call and let us know. Our concern, again, we don't have crisis services. So if somebody themselves is identifying that they need services, we would recommend that they go to the emergency room and have the emergency room contact us. Obviously, we want people to be safe first, so we would recommend that.
Okay. And the last question I have for today is, where can I get more information about the SBHU?
Sure. So you can go online to St. Joseph's website, and there's information about us there. And you can also call, and we're happy to give the information. Or we have a great marketing director who specific to the SBHU, and he has been going out to a lot of areas and talking with a lot of facilities. Is happy to provide information. His name is Peter Burke, and we have pamphlets that we're happy to give out to the community. And of course, Dr. Marshall has been doing a lot of talks and giving that information. So we're available for anyone who needs more information.
Great. Well, that is all I have for questions for today. And so first, I just wanted to thank both of you for joining us and for answering all these great questions. And thank you to our audience members for tuning in and listening to these two great experts as part of our weekly Meet the Experts series. So again, if you have any additional questions about the Senior Behavioral Health Unit, go to our website. You can do it in a search box if it's hard to find in the menu bar, and just type in Senior Behavioral Health Unit, and you can get all the information, phone numbers, email addresses. Certainly reach out to our Community Education Manager, Peter Burke, for more information as well. But we hope this helps. We hope this helped to answer some of the common questions that you might have about the unit. And again, thank you for joining us, and thank you, Dr. Marshall, and thank you, Maria.
Thank you.
Thank you. Take care.